When you are studying, who cares? You don't have to be professional. You gotta have fun, 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 fun. Today, I'm talking about tetanus and botulism. Well, let's go. Clostridium. Oh, Clostridiums are gram-positive, be positive, be positive, gram-positive. They are anaerobic, endosperm-forming roads. Yes, gram-positive, anaerobic. Right, endosperm-forming road. Then, now let's do Clostridium tetani. That causes tetanus. It is one that has the neurotoxin called what? Tetanus toxin. And the mode of action that it has is what? It blocks glycine and GABA. Glycine and GABA, okay? And it plays a role in the disease by inhibiting the neurotransmission in the inhibitory synapses, and so that leads to what? Spastic paralysis. All right. And then there's Clostridium botulinum. The neurotoxic is what? Botulinum toxin. The mode of action is what? It blocks the release of acetylcholine. And then what's the role? It inhibits the neurotransmission at the peripheral cholinergic synapses, at those neuronal synapses. If you remember the neuron with the synapses that will be at the end. And that leads to what? Flaccid paralysis. All right. Now, Clostridium botulinum causes botulism. It's supposed to spread in soil, contaminated food like meats and vegetables. If they are canned before the food is sterilized, or without adequate sterilization, what happens? The endospores, they survive, yo. Then they germinate, yo, in moist, warm, non-acidic, and anaerobic conditions in those cans. And then they produce the botulinum toxin. Whoa, somebody's gonna get sick. There are several immunologic types of botulinum toxin. There's type A, type B, type E, type F. That causes human disease. So I was playing earlier. I was just like type A, type B, make a B, type E, and type F. All right, yeah. I got my basketball here. I haven't really opened it yet. Woo. You have fun when you study, okay? Now, we got what? Type A, type B, type E, and type F. All right, botulinum toxin, AB toxin, consists of a small subunit, okay, light or A chain. Then there is a large non-toxic subunit. That's the B, or the heavy chain, okay? So just remember the small subunit, okay? The AB toxin. That's the botulinum toxin. That one is the botulinum toxin. Then the large one is the non-toxic subunit, B, heavy chain. Okay? Now, let's talk about mechanisms here. We're talking about the mechanisms. The botulinum toxin, you get it when you eat contaminated foods. It can also be absorbed in wounds, okay? So this type of toxin, it binds to gangliosides on the motor neurons and transported into the cell, into the cytoplasm. There's the light chain. So in the cytoplasm, actually, the light chain of the toxin. Okay, so you got your cell, you got your nucleus, then you got your cytoplasm outside. Outside the nucleus. Nucleus is here, and then the cytoplasm is there. So in that cytoplasm, the light chain of toxin, it cleaves one of the snare proteins. The snare proteins then mediate a fusion of acetylcholine containing vesicles and with the neuron membrane. Okay, so the snare proteins, they mediate a fusion of acetylcholine containing vesicles. Okay, so with the neuron membrane. Okay, so by blocking the vesicle fusion, the toxin can actually inhibit the release of acetylcholine from the presynaptic axon terminal into the synaptic cleft, and resulting in a lack of contraction and then flaccid paralysis. Oh wow, so that's the mechanism of action. Now we're going to talk about foodborne botulism due to ingestion of preformed toxin present in foods, typically home-canned vegetables, smoked meats, or vacuum-packed fish. Bacteria spores can survive in poor pasteurized canned foods. The spores germinate, they grow and germinate and produce potent neurotoxin and gas, seen in children and adults. The toxin is heat labile. It's inactivated by heating it. Heat it up, hit it, burn it, heat it up at 60 degrees Celsius or 140 Fahrenheit for about 10 minutes. 10 minutes, okay? For what? 60 degrees Celsius. 60 degrees Celsius for 10 minutes. 10 minutes. Got it? All right. Now, 12 to 36 hours after ingestion of the toxin, there is weakness of muscles. That starts in the muscle supplies of cranial nerve 12. So typically there's diplopia, double vision, ptosis, there's dysphagia, facial weakness, dysphonia, there's blurred vision, oh my goodness, with fixed dilated pupils. No fever. In addition, there is the dryness of the mouth, postural hypertension, there's nausea, there's vomiting, there's constipation and abdominal pain. Okay, so now let's go over. You have problems with your face. There's weakness. Problems with your eyes. Ptosis, diplopia. Problems with over here, dysphagia, dysphonia with your esophagus and vocals. You got blurry vision, right? That's your eyes again. There's no fever. There's no fever. There's dry mouth. There's postural hypertension. You got nausea. You got vomiting. You got constipation and abdominal pain. Okay. bilateral descending weakness of the peripheral muscles developed in patients with progressive disease. So that's both sides. Both sides, you get weakness of the peripheral muscles. Okay. And you get flaccid paralysis. There is death. Death can happen because of respiratory paralysis. Oh my goodness. I can't breathe. Just kidding. Because of respiratory paralysis. Sadly, patients maintain a clear sensorium throughout the disease. Woo! We just went over botulism real quickly. Now we're going to talk about infant botulism. It's called the floppy baby syndrome. It results from ingestion of spores, commonly from honey or soil. Spores germinate and produce a toxin within the intestinal tract. So I'm going to get a reminder of honey real quickly. I just got this local island honey. So this is a good reminder. So, honey. Don't give babies honey. Alright. The spores germinate and produce toxin within the intestinal tract. Typically affects the infants between 1 and 6 months. There is constipation, which is often the first symptom. The floppy movements due to weakness, trouble controlling their head, poor feeding, oh my, weak cry, irritability. Alright, you got this. Woo. Now, progressive disease with flaccid paralysis, respiratory arrest. Okay, I'm alive. Can develop. However, mortality in infant botulism is very low, 1 to 2%. Woo! Yeah, let's talk about the wounds. Typically, occurs in harrow wound botulism, and the wounds. I don't have a wound on me, but let's pretend it's one. It mainly occurs in heroin users. Do not use heroin. Do not inject heroin. Okay. It mostly happens in heroin users, especially in those whose skin pop. The spores in heroin germinate in contaminated wounds. The symptoms are identical to those of foodborne disease. However, the incubation period is long. It's long. It's 4 days or more. And GI tract symptoms are less, prominent. That makes sense? Don't use heroin. Alright. Now, let's do the lab diagnosis. Foodborne botulism is confirmed. We like results here. If toxin activity is demonstrated, the implicated food or the patient or is demonstrated in the implicated food or in the patient's serum, gastric fluid, or in their feces. Okay. Infant botulism is confirmed if the toxin is detected in the serum or in the feces. Okay. The organism can also be cultured from the feces. Now, wound botulism. botulism is confirmed if the toxin is detected in the serum or in the wound, or if the organism is cultured from the wound. Now let's repeat. Foodborne botulism is confirmed and demonstrated in the food itself, or in the patient's serum. Makes sense. The feces or the gastric fluid. Boom, booyah, you got it. Now, infant botulism is confirmed if the toxin is detected in the feces or the serum, or the organism cultured from the feces. Now, from what? The feces, the serum, or if it's cultured from the feces. You got this. That's the infant. The wound one is confirmed if the toxin is detected what? In the serum, or if the organism is cultured from the wound itself. Good, good, good. Now, we're going to go over the treatment. Now, the treatment. Patients with botulism require the following treatment measures. Use human botulism antitoxin immediately to inactivate and bind toxin circulating in the bloodstream. You need, so you're using human antitoxin. You're going to use adequate ventilatory support. Wound botulism sometimes requires you to do what? Surgically debride. Cut it out, doctor. Cut it out. So, what you can do? Use what? The human botulinum antitoxin immediately, right now, to what? Inactivate the unbound toxin that's what? Circulating in the bloodstream. Okay? And you need to give them adequate ventilatory support. And then what? Wound botulism requires some what? Surgical debridement. Remove debris. Like, just remove the tissue that has it. Alright, easy peasy. Yay. Prevention. Do proper canning of foods. Pressure can heat food to high temperatures and destroy the spore. Okay, so pressure and heat the food to high temperature, and that can do both high pressure and high heat when you're canning, so that destroys the spores. Prevents the spores from germinating by maintaining the food in an acidic pH. Will store 4 degrees or colder. Okay, prevent the spores from what? From germinating by maintaining the food in an acidic pH. Acidic. Acid makes sense. Put it in acid, okay? We'll store it in a very cold temperature. 4 degrees. 4, that's cold, or colder. That prevents the spores from germinating. Then heat. Or canned foods to destroy preformed toxin. Heat the food from the can. Don't just eat canned food. Heat it up. Children younger than 1 year should not eat honey. Avoid giving honey to children that are younger than 1 year. In the absence of competitive bowel flora, C. botulinum can colonize the GI tracts of infants. All right. Botox, to those who like to look beautiful. It is generally safe when administered by a licensed healthcare provider. After treatment, the desired effects can be noticed around day 3 or 4. Ooh, results will be visible within 10 to 14 days on average. Baby girl, you look beautiful. I guess guys can use it too. Baby boy, you look good. On average, the effects last about 3 to 4 months. To maintain results, treatment should be repeated every 3 to 6 months. You got to go and get it done again. Every 3 to 6 months. And keep that beauty up. I see you. Alright. Now, Botox injections are used to address signs of aging. They reduce the appearance of facial wrinkles. Wrinkles all over. The widespread use of Botox in cosmetic surgery is based on its ability to cause paralysis of strategically chosen muscles on the face. So strategically chosen muscles on the face are paralyzed to make you stay looking beautiful with no visible wrinkles. Botox injections also treat medical conditions like crossed eyes, which we call what? Strabismus. I don't even know how to say it. Cervical dystonia, severe neck and shoulder muscle contraction, excessive sweating, hyperhidrosis, chronic migraines, overactive bladder, blepharospasm, and controlled blinking. And eye twitching. Yeah, I'm not doing it. You got the idea. You got the idea. You got it. So you can use it for what? Crossed eyes, cervical dystonia, hyperhidrosis, chronic migraines, overactive bladder, uncontrolled blinking, and what? Eye twitching. Now, Clostridium tetani. Tetani for tetanus. It causes tetanus. And those spores are round and terminal spores of this organism. They are ubiquitous in soil. C. tetani produces two toxins: an oxygen lava hemolysin tetanolysin and a plasmid encoded heat neurotoxin Tetanus Botulism, and AB toxin. One is what? Oxygen biohemolysin called tetanolysin, and the other one is a heat bioneurotoxin called tetanus plasmin, and AB toxin. Tetanus plasmin is responsible for the clinical manifestations of tetanus. You always see a picture like that looks like this. Like I don't know how to do it. But you've seen that picture before in your textbook. Yeah. Somebody lying down doing that. And their face like, yeah, tetanus. Now, transmission. The spores are introduced through penetrating trauma like punctured wounds. Rusty nail penetrates the foot or cut. Ouch! From a recently washed kitchen knife. Oops! I always cut myself sometimes. Spores germinate and the toxin is released by vegetative cells at the wound site. Germination is favored by neurotic tissue and poor blood supply in the wound. Incubation is 5 to 15, with the average being 8 to 12 days. Incubation period. All right. 5 to 15 weeks. 5 to 15 weeks. With the average being 8 to 12 days. Okay. So spores are introduced through what? Penetrating trauma, or maybe you cut yourself with the racinel or kitchen eye. The spores, they germinate, and the toxin is released by vegetative cells on the wound site. Germination is favored by what? Necrotic tissue. It's followed by necrotic tissue favored by, I don't know, that's what it says. And poor blood supply in the wound. Incubation 5 to 15 weeks, with the average being what? 8 to 12 days. Mechanism of action of tetanus plasmin. Tetanus plasmin binds to nearby motor nerve ending in the injured tissue. It then travels retrograde axon transport system to the cell bodies, these neurons of the spinal cord and brain. Toxin diffuses to terminals of inhibitory neurons with both glycinergic interneurons, brain shell cells, and GABA secreting neurons, and clears the snare proteins and release the inhibitory neurotransmitters. Glycine and GABA is blocked, and the motor neurons are inhibited, become hyperactive, and the muscles constantly contracts. Muscle spasm and spastic paralysis. Wowee. All right. Generalized tetanus is the most common form. The spasm begins in the face muscles, now lower jaw. From there, it spreads throughout the body, and sudden and powerful, long-lasting, and very painful contractions of muscles. Most cases occur in unvaccinated individuals. Get your vaccine. Only affects the skeletal muscles. The skeletal muscles. Classic triad of symptoms include trismus. Oh, look, Joe. Okay. Involvement of the muscles. Rhesus sardonicus results from sustained contraction of the facial muscles. Oxytotonus. I don't even know how to say it, but that is a pronounced arching of the back, and the patient resting on heels and back of his head. And if you see in the book, they'll be lying down like this. All right. You've seen that picture. If you didn't, go look it up. Now, generalized tetanus are the early signs on this page. Oh, difficulty swallowing, neck stiffness, abnormal rigidity. Feeling a little bit rigid today. My neck feels a little stiff. Just kidding. Okay. And breathing problems. I can breathe. Whew. Thank God. So, dysphagia, neck stiffness, abdominal rigidity, and breathing problems. Whew. Autonomic dysfunction in patients with severe disease, cardiac arrhythmias, fluctuations in blood pressure. My blood pressure. It's just kidding. Profound sweating. and dehydration. I need some water. Not for real. Yeah. Got dehydrated. This is empty. Need some water. I'm dehydrated. Just kidding. Now, so we say what? Cardiac arrhythmias, fluctuations of blood pressure with profound sweating, and we got dehydration. All right. We got dysphagia with neck stiffness, abdominal rigidity, and breathing problems. Yeah, that's generalized tetanus. Localized tetanus remains confined to the musculature at the site of the primary infection, persists for a few months and gradually subsides. We got the cephalic tetanus. This is a rare form of tetanus that results from a head wound. The incubation period is short, just 1 to 2 days. The primary site of infection is the head. It results in weakened muscles in the face and spasms of the jaw muscles. In contrast to the prognosis for patients with a localized tetanus, the prognosis for patients with cephalic tetanus is very poor. Okay? Neonatal tetanus. The umbilical cord cut by a non-sterile instrument is a risk factor. Treatment of the umbilical cord stopped with animal dung can also cause this. I don't know why they do that. I've never heard of it until now. But anyways, it occurs in newborns who are born to unvaccinated mothers get vaccinated. Inability to suck or cry after day 2 of life. Inability to suck or cry after day 2 of life. Infection usually occurs after contamination of the umbilical stump. The mortality of the infant exceeds 90%. Neonatal tetanus mostly occurs in the developing countries. Diagnosis is based on the clinical presentation and not on the lab test. Tetanus is a medical emergency. Good old doctor. All right. Move. Immediate treatment with human tetanus immune globulin, aggressive wound care. Drug control. Give me to control the muscle spasm. Give me the antibiotic. Metronidazole, alternative penicillin. Tetanus vaccination is what? In non-immunized individuals and those whose immunization status is uncertain. So they can be what? Vaccinated. What are the meds again? Metronidazole. Okay. And what? Penicillin. Think about a pen if you were sketchy. Penicillin. You think about the metro train. Metronidazole if you were sketchy. You know what I'm talking about, right? Now, prevention. Toxoid vaccine. DTaP. TDaP. DTTD. Those are the toxoid vaccines, all right? TDaP. TDaP. I say it twice. Okay. DTaP and TDaP. DTTD. DTaP. Hey, DTaP and TDaP. DTTD. DTaP. All right, got it. So the DTaP or DT, you have you have to give 5 doses completed by 46 years of age. Then the TD have first booster vaccine at 11, 12 years of age. A single dose of TD up should be given to pregnant women, right? And then TD next booster 10 years later. Then repeat it, what? At 10-year intervals. Now, let's think about how to remember this. The first one, D comes before T, so DT up. Okay, here's what? 5 doses. Completed by what? 46 years of age. Almost like the average of 4 and 6 is 5. 5 doses, so around 5. You're done with what? DT up. Then there's the TD up. That one almost sounds like 10. It's the first booster vaccine at 10 plus 1 and 10 plus 2 at 11, 12 to 12 years of age. The single dose of what? TD up should be given what? To pregnant women. All right. So, and it's a booster for kids 11 to 12 years of age, but a single dose can also be given what? To pregnant women. All right. Don't forget that. Then the next booster 10 years later is TD. And then you can repeat that every 10 years. Got it. Woo. Yeah. And the source here says always CDC. TD up is for young children who are 2, 4, and 6 months. Can be given also 15 through 18 months and 4 to 6 years. Okay, and the TD up for the preteens 11 to 12 years, and then the TD or TDUP for adults every 10 years. All right, you got this. Now let's move on. Well, ladies and gentlemen, I tell you that we reached the last slide. We went over tetanus and botulism. Alright. Think about botulism and tetanus. Alright. Now, let's go over a little review about what we learned in speed mode. Alright, Clostridium tetani. It blocks glycine and GABA, right? And it leads to spastic paralysis. Clostridium botulism. It blocks the release of what? Acetylcholine. And it leads to what? Flaccid paralysis. But really, I said Clostridium what? Blocks glycine and GABA. It's the tetani. And which one blocks acetylcholine? It's the botulism. Alright. A for acetylcholine, B for botulism. A for acetylcholine, B for botulism, and causes F. Whew. Flaccid paralysis. Okay? And you can also think about F for face, because the botulinum toxin can be used for products for your face. So, A, acetylcholine, B, botulinum toxin, then F, face, and also the flaccid paralysis. Glycine GABA, of course, then it's blocked, but in the its mode of action for Clostridium tetani. Okay, it blocks what? Glycine and GABA. And when that happens, you get what? Spastic paralysis. Now, you can go review what glycine and GABA does. You can go and review what acetylcholine does normally. And you got this. You got this. TD up. What do you give first? DT up, A2 for 6 months, and then you give the TD up near 10 at 11 and 12 years old, and then you give the TD or TD up to adults every 10 years. The pregnant women get the what? Not the DT up by the what, but the TD up. All right, let's look up. Did I say it right? Oh yeah. See, I told you guys, you got it. If I got it, you got it. You got it. And what medication do we give for tetanus? The metro. Think about the metro. Somebody with tetanus is on the metro. Think about sketchy metronidazole can be given for tetanus. And what? Penicillin. Penicillin. All right. Now, what do we say we can use to treat botulism? You use the human antitoxin, and you need to give them adequate ventilatory support, and you need to debride. You need to do surgical debris. Oh my goodness, we're done for an hour. I got to go. God bless you. Study hard. When you study, just have fun. Just have fun. Just have fun. Who cares? You don't need to be professional, yo. Study hard. We got that.